amongst the Indian men in the age group of between 15 and 25, the commonest cancers would be the testicular tumors, would be the sarcomas, that is of the soft tissue in the bone. Then there would also be head and neck cancers. To some extent, you may get lung cancer and colorectal cancers. These are the commonest. But the blood diseases, that is leukemias and lymphomas, is quite common in this group of patients. Amongst the women, it is the cervical cancer and also the breast cancer which are most prevalent. Also, gallbladder cancer amongst women is also quite well known, and colorectal cancer. Stomach cancer is also coming up in a big way in patients, especially those where they have these chronic gastric problems which are passed off and not investigated.
Any particular?
Normally these cancers in the head and neck area are generally due to tobacco, but they can also be due to other reasons like jagged teeth and also due to the HPV virus. Similarly, the cervical cancer amongst women is due to HPV virus of a certain type, and also the breast cancer now in young women. Now there was a time when we used to not even look at any woman between 20 and 30 that she could possibly have breast cancer. But today even young women are having breast cancer, especially where you have family history of breast or ovarian or uterine cancer. These people may. So these are people who have high risk, who have certain genetic predisposition where they can get cancers.
So Mr. Rakesh, what is the best combination of diagnostic tests that you can take to detect, say, lung cancer, which is one of the most commonest forms of cancer these days?
Now there are ample studies to show that lung cancer can be prevented, especially in the high-risk group, by doing lung cancer screening by low-dose CT scans. And this is established fact today. So if people can get CT scans done of the chest, we would be able to pick up disease much earlier. X-ray chest may not be good enough to detect it early, but CT scan will certainly detect it maybe a couple of months, even a year earlier than it would be detected on X-ray.
What is your take on the increasing number of cases for endometriosis? And do you suggest any detective test or?
Endometriosis is my gynecologist's domain, and I think they would be the best people to talk about it. I'm reminded that cancer prevention and preventive health checkups are very, very important. And I'm reminded of the term a stitch in time saves 9, and it's little strokes which fell great oaks. So I think if one takes this message, it's very important to have preventive health checkups, because they can detect disease early and may probably make the difference between a cure and a non-cure.
Any particular type of cancer that you're seeing in young women these days, as you said?
As I said, we are seeing a lot of cervical cancer, especially from the rural belt, and from the urban belt, it's the breast cancer which we are seeing now in younger women.
How can one prevent those?
These can be prevented by regular checkups. First of all girls who reach puberty must be vaccinated against cervical cancer. That is a must. Now it is a little costly affair, but I think it can reduce the incidence of cervical cancer. Second thing is this, as far as breast cancer is concerned, self-breast examination should be carried out by all and should be taught to all. There is a lot of educational material today where people can be taught how to do a self-breast examination. The second thing is that you can do breast cancer screening by people who are by doing mammography, especially in the high-risk group. And today you have the MRI, which is more sensitive than the mammography, and picks up about 98% patients with breast cancers. Especially if there are more than one cancers. Also, it gives you information about the axilla or the spread of the cancer to the axilla. So it's important to have this. But then The downside is that it is expensive. So it has to be judiciously used in those people who are at high risk or where there's a good clinical suspicion which then it will help us to detect.